everyone. I just wanted to give a little update. It's been about 5 weeks since my surgery. I had my surgery on the 20th of June. I believe today is the 28th of July. And it has definitely been a bumpy road, but I will take all of these small bumps in comparison to the excruciating pain that I was going through for the last 2.5 years since my ovarian cancer surgery. For those of you that don't know how I came to have an ostomy, I have an ileostomy, and what happened was I had ovarian cancer. The cancer infiltrated my colon at the sigmoid. I had the sigmoid removed, and I had an anastomosis. The anastomosis started to stricture. I had the stricture dilated 5 times. I had that last summer in July of 2023, all the way through December of 2023. I had it dilated 5 times. And I had to do bowel prep 6 times because I had 5 dilations and then one colonoscopy at the very end. And each dilation requires bowel prep. And then the colonoscopy also requires bowel prep. And that did not fix it. And then I had an MRI enterography or something like that. And that revealed that I had a fistula. And the fistula was creating something called a fistula into the presacral space. Presacral space does not exist unless it's created by the fistula. The presacral space is on the inside of the sacrum, and basically stool contents were going into that area, creating excruciating pain. And in order to keep the stool contents from going into that area, we are bypassing the colon completely. I do not stool through my colon or out of my rectum anymore. It goes into the ostomy now, the ileostomy. And so I have pasty or liquid stool going into a bag, exiting outside of my abdomen. And it bypasses the colon completely to keep the stool away from that area. I woke up from surgery and immediately had complete pain relief. And although the ostomy is a challenging and has its own bumps in the road of getting used to, the difference being that the fistula was constantly getting worse and worse and worse. The ostomy is getting better and better and better. So with the ostomy, there is hope. With the fistula, it wasn't hopeful. It was just getting worse and making my life more miserable. And so I would take the ostomy 10 times over the excruciating pain that I was feeling with the fistula. And as a reminder, the fistula was causing excruciating pelvic floor pain, pelvic floor into the vagina, up through to the clitoral area, could not sit, could not lay down. Sometimes it would even go into my hips, into my piriformis on both legs. I had piriformis edema. And it would also start to cause me, like, with the waves of pain that would come and go, I could start to fall down. Um, and I didn't know what was going on. I was working with my doctors for a very long time. And I was also being gaslit, and they were telling me it wasn't coming from my rectum, and it was. So it was very long and tedious and heartbreaking and difficult road to get to where I am today. So I will happily take this ostomy over what I was experiencing any day of the week. Waking up and being out of pain was great. Waking up and being nauseated, barely getting food down past the back of my tongue was a new challenge. That, brushing my teeth was very difficult. Just swallowing pills that I had to take was difficult. Becoming allergic to something that was on the ostomy bag, or the treatment for skin breakdown that I had under the bag, was difficult because I ended up with a systemic rash. for contact dermatitis, which is just another word for allergic reaction. I had some kind of allergic reaction that also spread to my eye that's called systemic. So it wasn't just in the location of the allergen. It affected me in my entire body and it spread to my eye. And so I had a rash around my eye as well. I ended up on steroids and it took it away. So my skin looks amazing now underneath the ostomy bag. It looks perfectly fine. I'm wondering if it will stay that way because I was allergic to something. I don't know what it was. I'm thinking it might have been maybe the skin breakdown um, treatment. Sorry, I lost my words there. I might have been the skin breakdown treatment that we were putting on it because some of it leaked down my leg. It was a powder, and I saw the rash also go down the line of powder that was on my leg. So I'm wondering if it was that. But who knows? There was so much change that it's hard to tell. And it is still a little itchy. But there is no rash. The skin looks fantastic. So it's very hard to say until I get further away from not using the steroids. So time will tell. And so I said I had the surgery on the 20th of June. I ended up hospitalized again on the 9th, I think, of July. And it was because I had a post-op fever. And the fever sent me to the emergency room. That was advised by my surgical team. And it was because, they were thinking maybe I had a post-op infection of some kind. So I went to my local emergency room. They did a CT to look and see what was going on. Locally, they told me I had another fistula. I had an abscess in the presacral space. And that was one of my biggest fears the entire time I knew that I had the presacral fistula because getting an abscess in that area could lead to sepsis and death. And that's why I wanted the ostomy so badly, in addition to the pain, because I did not want to get an abscess. Having all of that waste and the stool in that area, I was like, we cannot mess around with this. I want this ostomy as soon as possible, because I did not want to get an abscess. And the abscess would require most likely some kind of a drain. And where are they going to put this drain? That was always my thought. Was I probably have a lot of scar tissue going from the front side of my abdomen because of where the surgical scars are from the beginning of the ovarian cancer. They can put a drain in from the front or they can put it in from the back. And I'm like, what, am I going to have a drain hanging out of my butt? And for how long? And I was like, oh, great, let's get this ostomy. I mean, my head was going like, oh, let's get this ostomy. I don't want to have an abscess, but also because of not just the drain, but also because of sepsis and death. I was just kind of like, yeah, let's please get this going as soon as possible. We don't need that stool contents going where it doesn't need to be going, because stool is full of all sorts of bacteria, and if it's not going to the right places where your body can handle it as needed and as appropriate, it could get infected, and that would be bad. So, knowing this as a nurse, I was on it and wanted to make sure we made a decision very quickly. So yeah, when I went to the ER and they told me I had another fistula and I had an abscess, I was like, oh, I just thought the worst. I started freaking out. I started crying. But ever since I had the surgery, I had been crying every day. I had a hard time getting my emotions under control. I was just thinking it was because they pulled basically my guts, my intestines through my abdominal wall to create this stoma so that I could have this ostomy and have the stool and exit my body and bypass the colon altogether and bypass the the fistula to begin with. So I just thought, maybe I have dysbiosis in my gut. You have lots of neurotransmitters, hormones, and immune cells in your gut. So I just thought maybe the disruption the of the system in general was just making me extra um, sensitive and etc. So I just thought maybe time it would settle and figure itself out. But it just kept going and going and going, and I would cry at anything. Anybody would tell me a story, I would cry. Someone would come over, I would cry. Someone would do something nice for me, I would cry. I would be, not feeling well, I would cry. Something sad would I mean, I just would cry all the time. And I'm not a crier. I'm just not that emotional of a person. I'm sensitive to other people and what they might be experiencing, but I'm not a crier. And I was crying so much. And also when I came home from the hospital, during that June timeframe, I was in the hospital for about 5 days. So on the 26th or whatever after that, I could not sit still. I couldn't even sit for about 3 seconds. I would sit down, stand up. I was like, how am I even going to sleep at night? I can barely sit still. I was having such a hard time sitting still that I was like, I got to go back to work. I can barely sit. I'm up. I feel great. I have too much energy. I need to put this energy to work, and I needed to figure out a way to maybe go back to work for a couple hours, this or that. And then I got that fever and was thinking maybe now I have post-op infection. They freaked me out with another fistula and an abscess. And I got admitted, and they put me on an ambulance and they transferred me actually to the other ER where I had my surgery done at my surgical hospital, so that my surgical team could assess me. And so, um, excuse me, dry throat. So they sent me, to my other hospital. And that being said, I spent about 26 hours in an ER. Between ER to ER, I was in the ER for 26 hours. And I can't go into detail about what happened to me exactly in the ER, but I was just basically not treated like a person. I really wasn't. And because of my surgical procedure, the ostomy, I need to eat like every couple hours because I was so nauseated. It's the best way to treat the ostomy. It's also the best way for me to stay hydrated. Dehydration is one of the biggest problems with an ostomy, particularly an ileostomy, because you reabsorb your water in your large intestine. And because none of my food contents go to my large intestine, I don't reabsorb water. So the food actually helps you slow down when you drink any kind of liquid. The food slows it down so that your small intestine can kind of make up for what your large intestine isn't doing, because you're not sending any of your food contents to your large intestine. So you can get dehydrated very easily, particularly in that very early post-op period, because you're so nauseated, you're not eating well, you're not drinking well, um, you're very uncoordinated in your own care. And so I was very concerned about my nausea, very concerned about my ability to eat and drink, and none of these ER doctors were. And I had to advocate for myself and say, you have to hydrate me. And they were like, well, you can't drink. And I would say, well, then you need to give me fluids. And they would say, well, you can't drink. And I'm like, you need to give me fluids. You can't drink. And I'm like arguing with a wall. I'm like, fluids, okay? Like, I'm not asking you to drink. I'm asking you to give me fluids. And then a nurse would say, through the bag, like, give them to me IV. What do you think fluids is? Like, it's just so silly that you have to have these kind of dumb conversations with a medical professional. It's just dumb. I'm not asking you to drink. I'm asking you to give them through the IV. You have to hydrate me. I have an ostomy. You have to. It's you have to. It's a brand new ostomy too. I'm even more at risk. They had to hold me in in my first admission from the ostomy surgery. I got held in the hospital because I could not be fluid balanced, because my electrolytes were off, because I could not stay hydrated. They had to hold me in the hospital. It's just dumb. It's just really dumb. And you're arguing with a doctor over dumb language. And it was very frustrating. And I just, some of the things that were happening in the ER were just kind of setting me over the edge and really frustrating me and stressing me out. I wasn't able to eat or drink, for over 26 hours. And they were like, well, you might have to have surgery, so we can't. And I'm like, well, they don't have a plan. So you can feed me and let me drink, because I'm super not like, this is the reason I'm nauseated, is because I'm not hydrated and I'm not eating. If they don't have a plan, then I can eat and drink. There's no reason for this. And as soon as I got to my room, they were able to feed and let me drink. And it helped tremendously, but I was already to the point of, like, once you get to the point of being nauseated like that, it's kind of like it's hard to recuperate from it, at least in my experience. I can't speak for all people. I don't know how it is, but for me, it's like once I get to that point, it's almost like I can't, like, getting it reversed. It takes like a couple days for me to feel back to normal. So it was really, really, really frustrating. And so I was in for 26 hours in the ER, and then I was not even admitted. I think I went home. I got into my room at like 8 or 9 p.m. I think I was discharged by 11 a.m. I didn't eat, drink, or sleep. And at 11 a.m. the next day, I was discharged. There was no extra fistula, there was no abscess. And then they were just looking for some kind of infection. They found no bacterial infection that they looked for. They don't test for everything. And then they were just like, oh, it's probably viral. You can go home. And so it was like and my fever went away like so quick. I only had a fever for maybe like 5 hours. And then out of all of that. And so it was just this big, huge ordeal. And it felt like torture. And like I said, my therapist doesn't want me to tell the details of what that was like until she says I can, and I will share the details of what happened. Um, and and it was just basically all for nothing. I mean, yeah, I'm glad, like, I didn't have an abscess, and I'm glad I didn't have an extra fistula, but it was like the first hospital overread the CT, and my surgical team was like, that's not what's going on. And you just have some kind of virus, and it'll pass eventually, and you can go home. Just like, you guys just tortured me. And then I come home and I am not the same. I can't get it together. I do not ever want to see another doctor again. I'm emotionally overreacting to almost everything, as far as, like, ironically, people's dogs are dying on Facebook and I am bawling tears for them. Like, I can't get, like, I've never been that empathetic about anybody else's dog dying. Like, I always feel really terrible because I know what it's like and how heartbreaking it is. But for me to cry like that, like, just tears and sob and need Kleenex and everything for somebody else's dog that I've never even met before, just having these big emotional reactions. And I was like, I needed to have another CT because I had been having chest pain and like elevated heart rates that just don't make sense. And I broke down and started hyperventilating, and I was like, I'm going to need an IV and they're not going to be able to get it. And I'm going to have to argue with them, and I'm going to need an ultrasound because I don't have good veins in my arms. And I have them in my hands, but they need them above the wrist usually for a chest CT. And, and as a nurse, they always like push you, like, you need it above the wrist, and they get really kind of harsh about it. And so I know that they need that, or they really request it harshly, and I started crying and I was freaking out about it, and my husband had to like hold me and help me calm down and all of this. And I was like, I'm so messed up. I'm so messed up. And, I talked to my therapist about it, and she's like, you need to go to your primary care doctor. And went to my primary care doctor. There's a medication I've been on since I had my hysterectomy. My hysterectomy, after that, I could not sleep. And I also could not stop crying after my hysterectomy because they basically ripped my hormones out of my body by taking my ovaries, and which they needed to do. That was a non-negotiable with ovarian cancer. You're going to get your ovaries taken out. And I just could not sleep and I could not stop crying. And so I got put on something called venlafaxine, and it helped stabilize my mood with the crying. Also helps with the hot flashes. It's like the only medication that helped with hot flashes on the market that helps with both mood and hot flashes. So my primary care decided to bump that medication up to help with my mood. And they also told me they think I have PTSD from all of the medical things that have happened to me. After I started explaining, like, I don't want to go to the doctor. I don't want someone poking me anymore. I don't want this and I don't want that. And they treat me this way and they do this. And I started speaking in absolutes, like they always do this and they do that and they never do this and etc. And with the way that I was speaking, and they think I had medical PTSD, and it wasn't necessarily the emergency room that did it, but it might have been the tipping point after all of like the 3.5 years of things that I have been through, especially in such a short amount of time, and the numerous amount of things that I have been through. And when they said that to me, I obviously cried, but I also was relieved because it made perfect sense that, oh, yeah, that makes sense. And I was relieved because I had an answer to why my behavior might be the way that it is and why my emotions might be the way that they are and why I might be overreacting. And I would call it hypervigilant and reactive to some of the things that I'm reacting to and the way that I'm reacting to them. So those are some of the examples of what my PTSD looked like. I can't say that for everyone. I've seen other examples of PTSD that looked very different. They almost look like mania. Mine looked more like depression and just aversion to getting help. I didn't want to get help anymore. I didn't want to go to the doctor anymore. I'm sick of fighting with people. I'm sick of them not listening to me. I'm sick of being gaslit, which I am. I am sick of all of those things. But it doesn't mean that they're always happening or they're never listening. When it does happen, though, I'm going to be very blunt about it. And I'd be like, I think you're not listening and I think you're gaslighting me, and I'm just going to be more blunt about it because I am sick of those things and it has happened a lot. And I do think that's how I ended up with an ostomy, because the doctors, I have notes of theirs where they're just basically, I re-educated the patient that this pain is not coming from their rectum. And then I got the MRI and it was exactly what was happening after I had told them step by step what I was feeling. And the MRI explained exactly what I was saying for over a year. And it was very frustrating, to have that happen. And when your doctors just blatantly aren't listening to you. So, I think that's part of the medical, PTSD. And I'm okay with talking about it because it's no different than me getting an ostomy or me having cancer. It's something, it's an injury that can happen. It's just an injury in your brain. And having been told that, like 50% of the problem is gone. Like I don't have aversion anymore because I know what happened. I know why I was behaving the way I was. For me, knowledge is very powerful and it just calmed a lot of the things down. Also, I think the medication helped. They usually say it can take a few weeks, but for me, it's almost like flipping a switch. It works like right away, and it helps a lot. But really, as soon as I wasn't even on the medication yet, and I had already stopped crying, I wasn't crying every day. So there's something about just knowledge being so powerful for me. And even when I was talking with my therapist before I even knew that PTSD was even an option or part of, my diagnosis was, I was crying about this. I don't even know why. And then eventually she was like, I know you're a scientist and you want to know why, but, PTSD and depression, let's just call it that. PTSD and depression, that's your answer. You don't have to have any other reason why. Or you're crying because you're happy, and that's it. You're crying because you're happy because you have such a supportive husband, and another thing was is I went somewhere and I was overreacting because I was listening, like I heard people talking. I just didn't want to be around people. I was just like, I'm just so irritated. And two things that people use to describe me often, over and over and over again. Very, very patient. You're so patient. And I am. That is very true. I will be so patient. So patient. I was not patient. I couldn't stand to listen to these people. I don't know what they were talking about. They were just minding their business, having a good time. I couldn't tell you what they were talking about. But just the chatter, just whatever it was, I was like, I gotta get out of here. I can't stand to hear it. I just, the auditory extraness of it was just, I gotta get out of here. And I told my husband it was somewhere I asked to go, and I was like, I couldn't even stand to be there for 15 minutes. I gotta get out. And he was like, okay, we'll go. And he's also very patient, and he's also very understanding. So he's like absolutely perfect for me. And we communicate very well. And I can just say, you know what, I'm really sorry, but I've I'm very irritated and I reached my limit. I know we just got here, but we gotta go. And he's like, okay, I'm just gonna get my food and we'll go. And so, super easy. He makes it very easy to just communicate and um, get whatever help I need. So, I'm very grateful for him. But yeah, ever since I found out what was going on, it's like 50% of the problem is gone. And for me, knowledge just helps so much. And, having my therapist, help me realize I was speaking in absolutes. I've done so much excuse me, mental training on not doing that. Now I can catch myself. I'm like, oh yeah, she pointed it out to me. I know not to do that. I trained myself not to do that a long time ago, but this PTSD started making me do it again. And I'm not gonna, I already know not to do that. So it's kind of like I already have a head start on how to not speak in absolutes. So, it's already easier because I already have that habit. I just have to re-tap into it. So, it's already easier. And I think the medication helps too, having a little boost with that as well. So, I haven't cried, I think, in 5, 6 days. I don't remember how many days. I can't remember counting anymore, but I haven't cried ever since I found out that I have PTSD and got a little boost in my medicine a few days ago, and it's been really helpful. And so I just encourage anyone that if you've gone through anything that was just kind of life altering, like I have, so many things. I'm surprised it didn't happen sooner. For some people, it does. It does happen a lot sooner. I'm very surprised it hasn't happened sooner because I've been through a lot. Um, but if you just find that you're just way off, and you have gone through some things that are life altering or, have jolted you in your family, in your career, anything like that, and you're just not behaving the same way, and you're just kind of, or you notice it in your spouse or your loved one, a friend, anybody, maybe just suggest to them, like, hey, you should might want to go talk to someone. Like, maybe something's going on. Maybe this is affecting you more than you realize, and maybe there's some more like help that you can get with this, or maybe a professional has some suggestions for you, because that's all that it really was they were like, maybe you should go get professionally evaluated for PTSD. And then the psychiatrist was like, yeah, that's what's going on. And it was very easy for both my therapist and my psychiatrist to be like, yeah, this is very easily PTSD. So um and that just made me honestly just feel better. And as soon as I knew that, I was already recovering just from knowing what was going on, instead of just thinking it was just some kind of like dysbiosis in my gut because they pulled my intestine through my abdomen, and sometimes that does happen, and then sometimes there's another reason. Sometimes you maybe just had it up to here or here with the medical system and like everything that you've been pulled through in all the different directions. And that week I got diagnosed with PTSD. I had a doctor's appointment, sometimes more than one, every single day. And it's a lot. It's a lot to manage. It's a lot to think about. And all I see is cha-ching, 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 like, how much is this going to cost? Because it's a lot of money, and it's a lot of being pulled in different directions. And it's just like, it's not even over, because I'm going to have another surgery. This summer, I was supposed to get my double mastectomy for having BRCA. I wasn't expecting to get an ostomy. I was expecting to have a double mastectomy. That's what I was thinking, and best laid plans, ha ha ha, it's like, there's gonna be more. It's not over. I feel great. I'm really happy. I mean, that, like I said, ostomies are challenging, and we'll talk about that in another video at another time. Um, but it's not over. There's going to be more. But we got to get through this first. Got to settle this first. Got to be okay with this first. And this has got to heal. And this has got to heal. And I honestly feel really great. Like, I'm so happy that I know that. I'm glad that I know what happened to my mind. It's been nothing but a blessing to know that, and to know, like, okay, now there's something tangible that we can work on, and something good that my therapist and I can work on. And um that's great. Like, these things can happen to anyone. They happened it they first started studying it with Vietnam vets, the PTSD. So it happens a lot with people in the military, but it happens to people that have gone through any kind of traumas. There's people that have been abused. There's people that have been through lots of medical trauma. I mean, you're talking about, I had cancer, I'm cancer free, but the traumas keep happening, things keep happening, and you keep getting in the system, and you keep getting things, things keep happening, and it's it's traumatic. It is traumatic, and that ER experience just tipped me over the edge, and I lost it, and I did not know I was losing it. I didn't know until my husband and I were like, I told him, he was probably looking at me like, what is going on with her? I was like, don't worry, I'm going to talk to my therapist. It's fine. Everything's going to be fine. And she was like, you should go to your doctor. And my doctor was like, you need to go to the psychiatrist. And I was like, tears, like, it just, but then it was just like, well, I'm glad that like someone told me, like, that. I'm glad, I'm glad I knew to go to my therapist, and I'm glad I knew and trusted my therapist to go to my doctor, and I'm glad. Oh man. It's okay. It really is. Like, I'm really happy that it all worked out, and I really do encourage people to get with your professionals because it's okay. It's okay that these things these things freaking happen. They can happen to anyone, anyone. You know, the two words that people always say, you're very, very patient, Melissa. You're so patient. How did you do that? How do you do that? How are you so patient? And I'm like, I don't know. It just doesn't bother me. And then they're like, "You're so strong. You're so strong. How are like you're like the strong." My even my therapist was like, "Melissa, you are one of the strongest people I've ever met." My therapist has been a therapist for decades, 20, 30 years, maybe even more. And she's telling me I'm one of the strongest people she's ever met. I'm like, you have had a lifetime of patience, and you're telling me I'm one of the strongest people you've ever met? That's crazy. That's a big statement. And yeah, popped. Finally popped. So it can happen to anyone. If I'm one of the strongest people she's ever met and it can happen to me, it can happen to you. And just, go get some help. It's fine. It can happen to anyone. We're human beings. These things happen. It doesn't mean anything. It's just your health, and if you push someone, some people don't have to be pushed far and they pop, and then some people got to be pushed really, 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 really far before it's too much. It it just depends on the person. Everybody's different. It's okay. We're all human beings, and it happens. Can happen to anybody. Just like a heart attack, it can happen to anyone. Cancer can happen to anyone. Everybody was like, "You got cancer of all people? You're like the healthiest person I know." Yeah, I got it. It happens. It can happen to anyone. So I wish you well. I hope this video helped you. And yeah, if you have any questions, I'm happy to answer them. You can talk to me about anything. I'm pretty much an open book most of the time. I mean, I don't know. We'll see. Sometimes I'm not, but most people, I'm a pretty open book. So, yeah, you can talk to me. I'm happy to answer your questions. And I wish you well. Of course, I want you to be well. That's why I share my story. I want people to be healthy. I want people to not be ashamed of anything that goes on with their body or their mind. Um, and I want you all to take care of yourselves. Take care. Bye.